Can using a cell phone cause cancer? Studies over several years have had conflicting results. And now a new review by the World Health Organization may be even more confusing. News 4's Dr. Peter Rostro has a closer look at what we do know.
Millions of Americans use cell phones and thousands develop brain tumors. But can the cell phones cause the tumors? Most studies have found no relationship between cell phone use and brain tumors, but some have suggested a statistical link. And now a group of 31 scientists from 14 countries meeting at the International Agency for Research on Cancer has reviewed all the evidence.
Whether there's an association with cancer in humans, what are the animal experimental data, and whether there are any plausible mechanisms. And the working group really assembled all that information and said that there is a possible risk of cancer associated with mobile phones.
There are 5 classifications: carcinogenic, probably carcinogenic, possibly carcinogenic, not classifiable, and probably not carcinogenic. Based on this new review, cell phone use is called possibly carcinogenic, along with 265 other things, including lead, nickel, pickled vegetables, and working as a dry cleaner, firefighter, or welder. One small piece of evidence, still controversial, is whether you're more likely to develop a tumor on the same side of the head where you hold the phone.
It seems logical that if cell phones were to contribute to the causation of cancer, the tumor would be more likely to be on the side where people use the phone. And there's some indication that that is, in fact, the case.
Notice that he used a cell phone during the meeting. Some people are already trying to reduce their exposure.
I use loudspeaker a lot now and the headset, but I'm not always on it as much as I was.
Using a speaker or an earphone and talking less will reduce the amount of radio frequency radiation that reaches your brain. Today's phones put out a lot less radiation than they did 10 years ago when many of those surveys were done. And the number of brain tumors has not increased much, even though cell phone use has gone up dramatically. So the risk, if there is a risk, is very small.
So we still have that question mark there, but what about children? I know it's a concern for parents. What about them on cell phones?
Children will receive more of the radiation, partly because children have thinner skulls. So if there's a risk, then limiting a child's cell phone use would reduce that risk. But there's still no convincing evidence that cell phones cause brain tumors. It's still possible.
Possible, so it needs, we need to be aware then. Yeah, all right. Thanks so much, Doctor.